thank you everybody for attending this webinar today. So this is webinar number 6 in the Power Platform series, and this one is going to be on compliance and auditing. Just a few housekeeping rules to start with. So this session is being recorded, as I've just mentioned. All attendees will be on mute and all attendee cameras will also be off too. If you do have any comments or questions, please do put them in the chat. So your speakers today is myself, my colleague Dan, and my colleague Aoife from Microsoft. So we'll just do a few introductions first. So my name's Karen Moore. I'm Head of Customer Success at DigPacks. I've been here about 6 months now, and previously I was with the Microsoft partners in the areas of Dynamic and Cloud Platform. Over to you, Dan.
Thanks, Karen. Hi, good morning, everyone. My name's Dan Jordan. I've been with DigPacks since the middle of last year, work as a business analyst and a product owner. I've been working in healthcare tech for the last 8 years and in tech before that for a long time. So looking forward to speaking to you today.
And to you, Aoife.
Thanks, Dan and Karen. Hi, guys. Lovely to meet you all. My name is Aoife Dempsey. I'm a product specialist on the Microsoft team for business applications, and I'm looking forward to bringing you through the material we've prepared for you today.
Brilliant, thank you. So for the agenda today, we're going to do a quick intro into DigPacks and the Microsoft Healthcare team. Then we're going to be explaining how the Power Platform can be used for compliance and audit teams. We'll then go through some of the impactful compliance and auditing Power Platform solutions which have been made by DigPacks. I'll then close by talking a bit about the upcoming webinars and events in the series, and then we'll do a summary at the end. So just a bit of an introduction on DigPacks for those who may not know us. So we were founded in 2019. So for 6 years, we have been creating low-code, no-code technologies for the healthcare industry mainly. And we utilise the Microsoft Power Platform for that. We've worked in collaboration with over 30 NHS trusts to deliver value through Power Platform solutions in the areas of apps, automations, web pages, and now into the area of AI with Copilot Studio. We're a local consultancy as well. We have 2 offices, one in Hatfield and one in Cardiff, and all our employees are permanent hires. And we are a trusted partner to Microsoft as well. We're a certified solutions partner, and we're recommended by both Microsoft and NHS England. So we have developed a catalogue of reusable solutions which are tailored to the needs of the NHS Trust, and many of these are actually featured on the NHS Mail Solution Store. As I mentioned previously, we are focused in the areas of healthcare, and we have extensive experience to create solutions for NHS trusts, including those who are on local and central tenancy. We are specialists in the areas of the Power Platform, and as mentioned before, we do work with Trust and NHS England, looking at the latest technology, looking at the latest developments in healthcare as well, and matching the two up in order to bring that value through solutions. And the way that we deliver solutions is through an agile methodology, enabling to realise the impactful solutions quickly and minimising that time to value as well. So I just want to speak a little bit about the partnerships that we have with Microsoft and NHS England. So with Microsoft, we do have a strategic collaboration. We do have regular cadences with Microsoft. We meet regularly through webinars, through meetings, and through on-site as well. And this is to discuss impactful solutions through the Power Platform that can be made available to trusts, and also getting the insight from Microsoft and from the industry as well. We also have a level of funding available to us from Microsoft for initiatives, and Aoife will talk a little bit about those a bit later on. So for NHS England, we work with them to get an understanding of the needs of trusts, and also the progression and where the technology could be a potential driver for value. as I mentioned before, we have a number of solutions that we have created up on the NHS England store, and through a program called Pioneers, we originally developed applications, and now we're looking to the next stage for automations and AI as well. And here you can see some of the solutions that we have created. They are in 3 areas: compliance, workforce, and HR, and operations. And once we start creating more solutions around the clinical area, that will have a separate section too. So in the areas of compliance, so this is some of the solutions which Dan will be showing you today. I just want to highlight a few in there. We have a DPIA app, document management and referral migration. In the area of workforce and HR, we have a staff app, which encompasses many parts of staff, such as changing circumstances and appraisals. We have an asset booker solution, which you can book desks with, and car parking spaces, and also car charging spaces, but any asset can be set up on there. And we also have a people onboarding solution as part of that staff app as well. If anybody's interested in understanding a little bit more about the workforce and HR solutions, there is a previous webinar that we did. And if you go into our website under media, you will see the recording of that. And under operations, we have solutions such as an application hub, e-observations, and waitlist optimizations. And then the bottom part of this slide, you can see just some of the trusts that we work with. And finally, just before I hand over to Aoife to talk about compliance and auditing solutions within the Power Platform, I just wanted to let you know that we've recently launched a managed service here at DigPacks. This is to allow you to have a number of hours each month where we can work with you on a backlog of Power Platform solutions that we can deliver for you. But not only is that service available under the managed service, but it also includes all of the other features you can see on the right hand side. So it includes the support for a support portal, a knowledge base, training and enablement. We can also deliver the Power Platform governance program too. Also, you have access to a library of components and access to all of our ready-made solutions as well. I'll now hand over to Aoife.
That's brilliant. Thanks a million, Karen. So today, guys, I'm going to talk you through the high-level benefits of the platform before Dan brings you through the solutions themselves. So as you can see there on the slide, standardization is the first topic that we're going to speak about. As you're aware, NHS trusts often have to juggle numerous forms and spreadsheets and different systems when it comes to compliance and auditing. This can lead to data silos and, unfortunately for you guys, a lot of wasted time. But with the Power Platform, everything is brought under one roof, including risk management and incident reporting, so that all of the audits can live within a single and standardized solution. Now, not only does this help ensure consistent data capture, but it also makes it easier for clinical and admin teams to collaborate effectively and access this data. And as well as that, by consolidating the compliance and auditing activities within the Power Platform, NHS can reduce reliance on multiple third-party apps. And again, this is no news to you guys, but this doesn't just cut down on licensing costs, but it also simplifies your overall technology stack. And from an NHS perspective, where budgeting is always top of mind, this approach allows trusts to optimize spending and reinvest savings in patient or care or other priority areas. And then in terms of automating the process, when process flows are automated, you're taking a big step towards reducing human error and improving response times. So for example, you can set up a flow that automatically flags a reported incident and assigns the relevant roles and triggers a review. So the platform can basically send reminders and notifications to keep everyone on track. And what it means in tangent is that there's just fewer balls dropped, quicker resolutions, and a more transparent audit trail, which, as you know, is critical for any healthcare environment aiming to meet the more and more rigorous compliance standards that we're facing today. And then finally, the data doesn't mean much if you can't interpret it. And the good news is that with the Power Platform's built-in analytics and its integrations with Power BI, NHS trusts can visualize patterns and themes across incidents and risk areas. So whether you're presenting to the board or planning a staff training. These insights can help you identify recurring issues and make evidence-based decisions, which is what we're all aiming for. And this ultimately leads to continuous improvement within your patient care and your service qualities. And then finally, just one thing to mention is that scalability and integration is another high-level benefit. I know that a lot of you guys already use Microsoft 365 for your day-to-day work, and the Power Platform plugs in seamlessly with those tools like Teams and SharePoint and Outlook, meaning that the staff don't have to become familiar with other interfaces and leave apps that they use every day. It's also very scalable, and as more users and types of audits come on board, the platform scales right along with you. But that's enough from me, so I can pass over to Dan.
Thanks, Aoife, and thanks, Karen. So in terms of things I want to go through now, I want to take you through a few different apps in different stages of their life cycle, each of which has a relationship with compliance and auditing. This will involve showing you some slides and also trying to give you a live demo of some apps that we have as well. So the first one I want to go through is the DigDocs application. So this is designed to streamline document management within the organization. It allows users to easily create, edit, share and manage documents in a secure and efficient manner. And it also has robust audit tracking features to be able to sort of illustrate how you have used and interacted with the different documents. What I am going to do is just stop sharing this screen and go into my own one, because I have got access to a demo environment of DigDocs. So hopefully everyone can see that one. And I will move over to
yeah.
Fantastic, great. So this is a demo environment of the DigDocs application, and in the home screen this provides an overview of the most recently and frequently accessed documents. It also provides quick links to carry out different actions, both in the button bar at the top in relation to specific documents, and also on the left hand side to carry out administrator tasks and also to review audits that we have. If I want to interact with specific documents, say for example, I may want to search for a given document. So if I wanted to find documents that contain the word discharge in them, again, I can use a pretty simple search feature at the top right, and we can see how it's filtering either on the title or description, also tags that we can apply to the document itself. If I just then remove that search option, and it will revert back to the full set of documents. If I want to do something slightly more precise, I want to look for specific types of documents, I can use one of these different filters that we have at the top right. So if I want to look for SOPs, it's then also able to narrow down the range of documents that I actually have. And just to give you a sense of what we can do, I could filter for documents that relate to a certain department, for example. Now, these lists are in your configuration control. So if you want to set your own taxonomy of classifications, absolutely within your something that you're able to do. Just one other thing it's worth noting in terms of the filters, you could build up quite a big library of these different documents that you have access to. Maybe some are of more interest to you than others. So I might want to look at the particular documents that I've bookmarked to help me more easily access the documents that are of interest to me. So just to go back to the active documents, if I think, right, there's a particular document that I actually want to go and review and have a look at, I can simply select the document, go to view, and then give it a second or two. What it will then do is open the document up where I have some metadata on the left-hand side that give me some insights into its currency and how long it is until its next review date. I can also see a preview of what's quite a simple document for this demonstration on the right-hand side that I would be able to review. What I could also do is actually show some controls and do a more specific search within the document itself, so I can navigate through certain keywords. I could also zoom in and zoom out, or if I want to interact with a document in a different way, I can quite simply open this up as a PDF in this example to look at it in a full screen presentation. If this is a document that I know I'm going to want to review regularly, as I have done here. I can put a bookmark on, but just to show, just backtracking through that one, if I remove a bookmark, just say it's not bookmarked, I can quite simply bookmark it. So I know that consequently, I can very easily find this document amongst my bookmark list. What we can also see in this specific document while we're here, if I want to understand what has been the interaction from an auditing point of view with this particular item, I can click on the audits button and we see we have quite a thorough list of the different types of actions that have taken place, by whom and when. So if there is a case that somebody is being assessed, maybe by the CQC, and you want to demonstrate evidence of how you are working with policies to manage your processes, this is a very, very useful tool on individual document to show I can evidence how we have been making use of certain policy documents as well. If I want to create a brand new template, yeah, that's a pretty straightforward one as well. I can go to new, and this will bring me a similar screen that we saw when reviewing an existing document, but gives me the opportunity of building up some of the definition of the content. I could use an existing template, so can simplify the process of creation. I can add in further information here. I'm not going to turn this into a typing exercise, but just give you a sense of what is possible. I can set review dates, so there's some control over knowing that we are managing this document to ensure that it stays compliant within a schedule that suits what we want to do. And also if I wanted to add tags into there to help classify the document, quite happy to do that too. Now I could continue to actually go into the document and actually fill out the content, but for the purposes of the demo, just want to show you the method of how you can do this, just to give you a sense of what's possible. Now, in terms of other things that I can do within the app, just going back to the home screen, I can, if I'm an administrator, I can carry out management activities in terms of managing templates, managing users, and managing the drop downs, the ones that we saw in previous screens. So these are very much under the control of your application administrators. But also if I want to look at audit records across the whole set of documents that I've got, I have this audit option on the left hand side that will enable me to look at different auditing activities, maybe within a given time frame. So there is some quite fine granular control of what I can do in terms of being able to sort of understand and analyze the auditing activities within this app. So that's sort of a quick whistle-stop tour, how I can search, how I can filter, how I can view documents, how I can create them, and crucially, how I can review and audit to see how people have interacted with those documents as well. So from a usage point of view, hopefully it's a relatively straightforward app. But what we've also got, and this is where I will just divert onto a pre-recorded demo that I have on one of the slides, just go into presentation view again and just hop through some of the screens if it'll let me. Okay, this might take a sort of a while to navigate through. I might try Plan B in a second. There we go, that's okay. Now, in terms of interaction with the app, we've been doing this through the app itself. But what you can do, I'm just going to run a little short demo. So we can also set up a bot, and here's something that we created earlier. So I want to use this to say, please tell me how I can find an SOP about patient admissions and discharges. So the bot will then go and look at the repository of documents for you and then play back a summary of key information about this that it can present to you on screen. If there is another action that you want to take as a user, I can actually then use some of the little sort of footnotes that we can see there, and I can open the document itself. So what this means, it's a very way of, you can use natural language questions as a user. You can go and look through your library of templates. You can receive a summary about them, and also you can go and look at the document itself. So from an engagement and onboarding point of view, this makes it super simple for different users to be able to make use of the app in using tools that they're already very, very familiar with. So just having gone through that, just to summarize some of the key benefits, I think we'd sort of see this provides improved access. With the enhanced accessibility, users can quickly locate and retrieve documents from any device or location, streamline the workflow, reducing downtime. There's enhanced document management as the App offers advanced document organization and categorization features, making it easy to store, track and manage files, and also has version control and metadata tagging to help reduce manual tasks while ensuring that the most current document is at hand. And there's audit compliance, as we saw with the auditing screens. So it helps you to stay audit ready with detailed activity logs and compliance features built into the app as well. And it's got that sort of simple interface with the app features providing a sort of intuitive way of navigating around it to minimizing the learning curve. But if you have a bot, that makes it even simpler, where people can ask simple questions and retrieve the content that they want. And also there's efficient and controlled updates. Although I didn't get to go into that into much detail, when a template is created, there is the need to actually go through an approval process where you request approval. The document is either approved or declined. So there is a controlled way of making sure that documents, when they're created, only go into circulation at the right time, and they go through an approved process of update as well. So that's the first one, DigDocs. The next one up is the DPIA app. So just to go through this one, the purpose of this app is to streamline data protection impact assessments and simplifying complex processes supporting GDPR compliance, and it's user-friendly, supporting collaboration, and also it offers some customization features that we'll see in a short demo that I'll just go through now. So I'm just going to come out of the presentation mode of the PowerPoint, and I'm just going to go into a DPIA application that we have. So first of all, we are presented with a home screen which provides quick access to key features and a list of the DPI assessments. Again, this is just a test system, so there's only a limited sample, but it gives you a bit of a sense of the types of records that can be created. As with the DigDocs app, users can search and filter and view the records directly from this home screen. So if I wanted to look for a particular set of DPIs with keywords in, I've typed in the word payroll. It will then find a record that actually contains that as part of the title. If I want to be slightly more sophisticated in how I'm looking to retrieve records, I can use this filter option. So if I want to find the ones that have reached a certain stage in their life cycle, I can then select DPIA and it narrows that down. If I then want to just look for the assessments that have been assigned to me, again, I can narrow that down just to find a specific set of records that might themselves be a call to action to go and carry out certain activities. Just to simplify the screen, I'm going to close that one down. So if I want to actually go into a record to review it, just to see what has been done, I can select the record itself, go to the View Assessments option, and we can see that we've broken this down into stages, and these are in your configuration control, as I'll briefly introduce shortly. But within each stage, I can see the sections, so I'm perfectly at liberty to review what has been recorded within the app, and then look at the entries that have been put in, say both in the pre-screen or potentially in the actual DPIA itself. And we can see as I move through individual sections, we can both view the information, and if there are ways that we want to interact with it, potentially to add comments in, yes, that's perfectly possible too, but I'll just put a sample in. There we go, and we can add that, close that one down, and that's then logged against the record itself. But beyond that, if I want to create a brand new DPIA, so I can click on the plus button here, give it a second or two. So if I wanted to, let's just sort of put some sample pre-created data in here. So for a prescription service, I put a project summary in. I can add further information, and it's guiding me through the process. I've done this first subsection, and then it moves me on to the next section of screening questions. I'll just keep it super simple for the purpose of the demonstration. But what it does give us the opportunity of doing is, depending on the type of answer that I give, there's certain dynamism about it. By virtue of saying yes to this question, it then gives me the option of recording further information. And just to enable me to get to the end of this section, I don't want to turn this into a typing exercise, but what is quite helpful, when I've recorded all the mandatory information, I can submit this stage of the DPIA, and then I can record a signature against it. Again, just got a pre-recorded one there. And that's then moved through a first stage, which someone else will then be able to pick this particular process up, and they will be able to approve this. I have got another system where I'm pretending to be a different user, just to be able to articulate the fact that when you've created something, it needs to be approved by another person, but that other person can review this. So there is some control over going through the stages. But when they then approve that, they have the opportunity of saying, what are the further stages you want to go through with this DPIA? And they can record a signature as well. That's right, it's a little bit scruffy, but there we go. And that then means it has gone through certain control gates. So you're doing things in the right way to then be able to move through the process that you want. Okay, right. So with the key information recorded, I'm just going to go back to the presentation. Just go into presentation mode. So in terms of some of the key benefits that we would see through the DPIA app, improved efficiency, where it automates and simplifies the DPIA process. It supports GDPR compliance and thereby reduces risks. It supports collaboration and transparency as it facilitates communication within a centralized app, but also customization and flexibility. Now, one thing probably in my enthusiasm I did hop over, but I just want to take this opportunity to revisit within the DPIA app. We have gone through and seen that we can create the DPIAs, and we had some predefined questions that were there. But you may go through and think, right, there's a certain process that I want to follow, and I want to have a certain series of stages with my own questions. That's absolutely no problem. If I go back to the app and see for administrators, we have this form management capability. And again, this is just a little taste to give you a sense of what can be done. But there is control that you have over the different stages within the DPIA process. You can potentially also create further sections within them, and you can create your own questions. So you have a lot of control over the type of data that is recorded, the questions that are asked, the stages that they're in, just to guide the users through a controlled and compliant process as you're going along. And probably just one other thing, I just want to reiterate that we saw in the DigPacks app, but is also available within the DPI assessment app as well. There is a very clear and thorough definition of all the activities that have taken place. So if you're trying to understand who has done what, when in the process, we can select an audits record. So this is keeping track of everything that is taken place by who and by when. So you're able to sort of audit and understand the process of managing your DPIAs. Okay, so just glad to have the opportunity to make sure to go through a thorough review of that one. So just going back into presentation mode, just going to sort of keep going through those. So there are a couple more items to go through. These next couple I want to introduce to you. They're in an earlier stage of their evolution. They're not fully formed apps that we can walk you through in the same way, but just give you a sense of what is possible. We have this, just a mock-up on the screen here for a call handler audit solution, for which we have developed a proof of concept. And with this solution, there are a series of steps where people are taking calls in here for an ambulance service, and there is a need to audit a sample of those records. So what a user can do is take the audio file that's created from a particular call, drop it to a folder, and then from that file we can use the Power Platform solution to actually review the file itself. From this we can identify the call handler and also a reference. And using certain technologies, we can transcribe the file and automatically generate a summary. And this is what the auditor can review. They can open the notes from the call handler that are added to a patient record system and make a comparison. So rather than listening to an audio file for an hour, might be depending on the length of the call, they just need to make sure the summary from the call handler matches what is in the patient notes. And the key benefit of this proof of concept app is that it saves a lot of time for the auditors. And it is worth noting that this app uses the Power App that we can see on screen with the dashboard of all the different records, the ability to access different sections of the system. It also uses Dataverse for storing data, SharePoint for file storage, and Azure transcription services for transcribing the file. And it is worth noting that this solution is still under consideration. It does illustrate the art of the possible of what you can do using Azure services. Next one up, again, another one that is actually in development with a specific trust. This is for ligature risk, an app that we are developing at the moment. And just to provide a bit of context, there are some key goals that a particular trust that we're working with has for this app, where they want to move away from some very manual spreadsheet-based processes. So they want to have something that's transparent and accessible to all through an app. One of the key things they're looking to do is reduce ligature risk and enhance patient safety. And they want to support the timely completion of follow-up tasks, because when they go through this process, there's a lot of follow-up that needs to take place. And by consolidating this within an app, it will enable them to do that. And also they want to develop a process that enables them to record the data in a way that aligns with a CQC ligature point recording template. So it does follow that model and gives them the confidence they're doing something that is working in a compliant way. So this app is designed also to address a range of pain points, something that currently is very, very manual and time consuming. There are potentially some variations in the way the process runs, where they're doing it quite often on paper, where they're recording notes and then putting data into spreadsheets. And also they want to address some of the challenges in making the information visible as it moves through its life cycle, where it's kind of hidden away on individual files, potentially on paper. Now, as we can see or get a bit of a sense of from these screens that we have, this presents a summary dashboard of some of the different assessments that are within the system. So it does, or it will provide the opportunity to schedule and create an assessment for each area. I think the top level in this context is for each ward. The users will be able to see a list of assessments in the dashboard with their status, date of assessment, and identifying who the ward manager is. And as is kind of indicated here through we'll probably see more clearly on the next screen, there is going to be the ability to log actions as well. Again, just moving into a particular assessment where we can see that there is some summary information about the ward that a particular assessment relates to, some of the key dates that relate to its management. And on the right-hand side, there is a structured way of being able to record the different stages that you have for pre-assessment review questions and then ligature risk point assessments, questions that users will be required to answer, and also with each of these the ability to log different actions that need to sort of take place and to be managed. So there is a good controlled way and visible way of being able to take actions to manage the assessment itself. So as I noted before, this is still in development, but as we are aligning to the CQC model, we see this as a solution that could potentially have broader applicability to different trusts where they need to carry out this process. Okay, so one more to go through, and this one is for risk assessment. For risk management, where you're carrying out inspections, and this is one where we have got an app that will be able to give you a little walkthrough just to show you what you can do. So the purpose of this risk assessment app is to provide a user-friendly interface for managing inspections, risk assessments, and associated actions. It enables users to efficiently handle inspection details, track risk types, and manage control measures, ensuring there's thorough oversight and accountability in risk management processes. So just moving away from the slides for a second, I can come out of here and go to the actual risk assessment inspection management app that we have. Again, similar to the other apps that we've shown, we've got some kind of common design principles where we have a list of options on the left-hand side to help you navigate through a range of configuration and auditing screens. We have this kind of home screen with a dashboard of the different records that are presented in rows with some of the key information. And we also have some searching and filtering options as well. So if I wanted to search by a given keyword, and it's very dynamic in the sense that I put the keyword in and it will then find those risk assessment inspection management records that meet that criteria. So it helps me find specific records. Equally, I can filter as well within this particular option. So if I wanted to find particular records that are overdue, I can use this status filter option, and then this can actually narrow down the display. So in itself, the filter could be a call to action to help me review some of these in more detail, and then be able to potentially engage with the manager and understand where it's got to in its life cycle. So picking one of these particular records up, if I select the record, and then as we can see, there's the similar button that we saw in the previous DPI and DigDocs app. If I want to view an inspection record, this will up a new screen where I can review some of the key headline data about it in terms of key dates, a summary description, maybe the manager if I want to have a conversation with them. This helps me understand who it is and understand where it is in its life cycle. At the moment, we just have this one risk type recorded here, but by virtue of selecting that, we can see that the screen on the right-hand side changes, and there is a way of interrogating some of the detail recorded against this particular risk. So I'm just going to expand these to give you a sense of what we've got for different hazards, some of the different scores attributed to those, the categories of people that we'd see that might be at risk related to this risk type, some of the controls that we have available to us, and also there are ways of recording different actions that we'll see. We'll just create a little sort of quick demo of a new record, and also the kind of the headline risk scores for this as well. So that's an existing item. Now, if I just simplify the screen again, close down the filters, if I wanted to create a brand new record, I can click on the plus button and I can record some key information in terms of the scope. Say it's departmental, say it's for today, and say if I wanted to record what it's going to be about, say this is a fire safety inspection, I can say what it relates to. Hopefully I'll be able to choose the appropriate department, identify who the manager is, and when I create that record, it will pre-populate some of the information I put in on that first screen and give me the opportunity of adding in further data. So if I want to record the risk type of fire safety, and what it's also now doing is pre-populating some of the hazard and the control information that might be associated with this particular risk, because we can see rather than having to key this information in from scratch, as part of the configuration of the app, you have the opportunity of pre-populating certain values. So if I wanted to record some hazards and some hazard controls, yeah, quite happy to be able to do that within the system. We can see it's pre-populated some harm scores here, and we can see how that'll flow through to a residual risk as we move through. And then we can see there's some different categories of people who could be considered at risk that I can then record some values against to identify whether that is the case. And then just moving through here to controls. So there are certain controls that we have in place to be able to manage that risk. And I can record certain values against those to say where they are in terms of the implementation of those different controls. If there are things that aren't implemented at this point in time, I may wish to, when I save this record, want to record some actions of things that need to take place so I can keep control and keep track of those things. So if this is for training, again, I'm just going to put some sample data in here. In practice, I'll be probably more methodical, but this just gives us a bit of a sense of what is possible, and I can set target dates when these actions need to take place too. So I'll just resave that one. So that just gives us a bit of an idea of how I can, just going back to the home screen, how I can review the different risk assessments that have been created, search for specific options with searching and filtering, and then go through the process of creating a completely new item, but making use of some pre-configured content that has been set up already. So just to quickly introduce that, where I had fire safety, I think there's a risk type. Again, going into this configuration screen that would just be available to your administrators. By virtue of selecting that one, I can see that the values that I had available when I created the actual new record, these are based on some configuration values that I have on the left-hand side, and these are all very much within your control in terms of defining what it is you need to meet your requirements. Probably just one other little thing I want to introduce here in terms of understanding what has taken place in terms of the actions that people have carried out, or the activities or the interactions they've had. We have audits. So all of the work that has been done, all the different interactions and touch points with some of the different risk assessments, they are logged within the application. So we can see within the context of each particular inspection that's been done. Hopefully this one will filter it down. There we go. A particular inspection for dermatology. We can see what has happened, when, and by whom it was carried out. So that's an overview of the risk assessment app. So just going back into presentation mode here. So we've gone through, just got an overview, gone through the demo, didn't have to use the video there. So now in terms of summarising some of the benefits that we'd see this provides: efficient inspection management. So the app allows users to create, view, edit and delete inspections with ease. It supports a thorough risk assessment. So it provides pre-built inspection process that allows users to conduct thorough risk type assessments. Users can add actions against controls, mark inspections as complete, and auto schedule the next inspection as well. There is audit and compliance tracking. So this ensures transparency and accountability in the risk management process, helping organisations to maintain compliance with regulatory requirements. And as per some of the risk type options that we saw, there are configurable options. There's extensible configuration within the app itself. So that means you're in control of the configuration of it, and it provides the ability to create and manage risk types, user roles, departments and divisions. So this flexibility gives you the opportunity to really tailor the app to your specific needs and organisational structure. And that is everything from me.
Brilliant. Thanks, Dan. Does anyone have any questions about anything that Dan has shown at the moment? If you would like to put them into chat now, we do have a little bit of time. We'll then move on to the close for the webinar now. Okay, so I just wanted to let you know about a special offer that we have at the moment. It's for half a day of Power Platform app support for just £99. The offer is valid until the end of March, and the hours need to be used by the 30th of April. If you are interested, feel free to click on that QR code now. It will auto-populate an email, and you could just send that off saying that you're interested in that offer. Just going to hand back to Eva now just to talk a little bit about the Microsoft Healthcare team and what services are available to you.
Yeah, that's brilliant. Thanks, Karen, and thanks, Dan, for that brilliant demo. So what we can do is we can support you guys with different types of fundings. So DigPacks have a workshop that they can avail of funding for, which is a low code and no code vision and value and governance strategy session, and then they can also avail of post-sales funding for a deployment accelerator. So if you're interested in any of the things discussed on this call, it's definitely worth reaching out and having a chat about what pots are available. And what you can see on the right is my team, Mehmet, who's on the call, Nazra and Elena, who are more than happy to help as well with any additional or Microsoft specific questions. So we look forward to hearing from you, hopefully over the coming days and weeks.
Brilliant. Thank you. So we are in the process of planning the webinars for the next 6 months. But before then, we can share with you some of the initiatives that we are looking at. So we're planning on provisionally holding a webinar on HR Help Desk on the 9th of April and an in-person event in London in May. If you click on that QR code, it will take you through to the web page on our website, which will then detail the current events that we have, but also the upcoming ones that you can register for. So I just want to say thank you for attending this webinar today. I'm going to leave our contact details on the screen if you would like to get in touch with us. I hope you have enjoyed the webinar and I hope you have a nice rest of your day. Thank you very much.